The topic at hand today is whether or not early intervention is better to help children's development. Early intervention is defined by William Heward in his Intro to Special Education 10th edition textbook as services provided to infants and toddlers which enhance development of young children who are at risk of developmental delays by preventing those delays entirely or by minimizing their magnitude. Early intervention is important because it minimizes the need for special education when the child gets older, as well as increases the child's independence. I would like to explain to you how early intervention is the method of choice by helping children with disabilities enhance their development. By talking about a few disorders which increase success using early intervention, I'm sure you will agree. Attention deficit disorder has been successful by using generic behavioral interventions, such as the First Step to Success, which was created in 1998. It creates a home and school partnership in which a teacher and the child's parents, as well as the First Step behavioral coach, work together to teach the child school success skills. This sets standards for at home and at school to help with continuous progress. A study called the Preschool ADHD Treatment Study included 304 preschoolers across 6 different locations. This tested whether medical interventions or behavioral interventions were better. The core symptoms of ADHD were improved significantly by the medicine, yet they were not long-term, and most children with ADHD retained their diagnosis 6 years later. Preschoolers were twice as sensitive to the medicine compared to elementary school students. Therefore, behavioral interventions would be more beneficial. Autism spectrum disorder is a disorder with no known cure. Yet early intervention and intensive behavioral and developmental intervention can make a significant difference in a child's IQ, language, and adaptive functioning, and can also substantially reduce the lifetime cost of care. Best practice for toddler-age children with autism spectrum disorder, according to Weatherby and Woods 2006, involves parents being coached to incorporate specific behavioral and developmental strategies into daily routines and family activities utilizing routines and activities. This embeds intervention strategies throughout much of the child's day to promote participation and learning in an authentic setting. This includes face-to-face contact, which is extremely important to promote social skills. Reading disorders such as dyslexia are learning disorders which have received significant success using the early intervention method. For children with reading disorders, phonological awareness as well as other decoding skills do not develop naturally. Therefore, early intervention is needed to help teach these skills. Information technology has helped in assessment and early intervention of reading disorders. This includes ebooks, audiobooks, and computer programs. Sergers and Virvan in 2004 designed specific training computer-based exercises to research the increased phonological awareness in kindergarten children struggling with reading disorders. The children worked with the program 14 times 15 minutes each, and the results showed substantial progress in these areas after the intervention program. With all the good early intervention has done and is doing, who would say it is not the best method for helping children with disabilities enhance their development?
Okay. As you heard, the affirmative side said that early intervention is better in treating younger children than later intervention. We as the negative side disagree with this statement and believe that later intervention can be just as successful in treating individuals compared with earlier intervention in many cases. Research has been done on testing the effects of late intervention and it has proven successful. According to Crash and McQuillan, educators can achieve great success with late intervention through the use of free voluntary reading. Free voluntary reading is reading because you want to, not because of an assignment. In the study done by McQuillan and Krashen, learning to read late did not prevent students from reading the highest level of literacy. In the cases the study reported on, the children did not read until they were 9 and 10. It was at this point pressure was taken off the child to learn to read. The study also The study also studied children with dyslexia and found the same approach proved to be successful. It was also reported that countries such as Finland and Denmark don't stress learning to read until the age of 7, and these countries rank high in terms of their educational system. These countries found that late starts were not an issue as long as the child had access to reading materials that were of interest to them. The overall conclusion of the study found that there is no critical period for learning to read. It can happen and improve at any age. The affirmative side argued that early intervention has proven successful within the school system. However, it is important to note that there are numerous discrepancies in the RTI model that can negatively impact the student. Intervention strategies such as the pull-out method, where the student is taken out of the classroom to work on their reading or to limit distractions, can give the student a negative mindset. Children are often affected by how their peers view them, and they can feel not good enough or like they are the dumb kid in class. This can lead to disliking school in general, which can impact their future. Also, the pull-in method can negatively affect both the student receiving extra help and the students not receiving special education services. In this intervention model, another teacher comes into the classroom and works with a student or a small group in the back of the classroom while the rest of the class is taught by the general education teacher. This model can be disrupting to both groups of students because of the added noise. Students can become more distracted because of this, especially the students who have ADD. And finally, the affirmative side said that early intervention was the best practice in helping young students who have autism spectrum disorder. According to a study done by Carol Hurlbut, parents who had children with autism made more progress with their child through homeschooling than the school did via early intervention services. The study found that in each household, the goals for the child were different. The parents' reasoning in homeschooling their child with autism was because they felt as if they had found a treatment plan that works, and the school didn't provide their child with effective treatment. More children are being diagnosed with autism, and the educational system isn't able to adapt to this increase, and as a consequence, the students aren't being effectively prepared for the future. With the evidence I provided you, you can see that late intervention can still work for an individual, and that there are numerous discrepancies with the RTI model that can negatively affect a student's educational performance and growth.
I disagree with the negative perspectives of early intervention and the response to intervention model. The RTI process has been scientifically proven to be effective for identifying children with special educational needs early on. More traditional identification methods for children with disabilities, such as the Ability Achievement Discrepancy Model mentioned in Exceptional Children, are based on the technique of wait to fail. The child must demonstrate a significant difference in performance before being identified for special education services. This means that the students are more likely to have a severely low performance or even fail before any action is taken to help them. The RTI model is different because it involves a series of procedures and monitoring methods to closely screen academic achievement and the behavior of students to detect the proper treatment for students with educational needs. According to Klotz and Cantor's article about response to intervention, benefits of this method include eliminating the wait-to-fail approach of traditional approaches, increasing the statistics of student success, and reducing the amount of students misidentified or unidentified for special education services. The monitoring nature of RTI also provides educators more significant information about students that will aid in improving their success in the classroom. As the first affirmative representative verified with her research, early identification is quite effective for children at a young age. Early intervention is especially important for the development of children with emotional or behavioral disorders. The Journal of Emotional and Behavioral Disorders considers family-centered early intervention to be highly important for these disorders, as environmental factors such as home life, the community, and school can play strong roles in causing emotional and behavioral disorders. It is important to begin with family-centered intervention as soon as possible for children, then progress to school-oriented intervention as the needs of the student changes with age. According to Education and Treatment of Children, untreated behavior and emotional problems can intensify, magnify, and expand as a child ages. The academic journal also gives evidence that a majority of accounts of early intervention for children with behavior and emotional disorders result in refining and diminishing lifelong problems associated with these disorders. Early intervention is the first step to improve the quality of life for children growing up with emotional and behavioral complications, and should therefore be a process that is started for children as early as possible.
We of the negative refute the position stated by the affirmative regarding the use of early intervention. I would like to refute the position stated regarding the effectiveness of early intervention for individuals with emotional, behavioral, and also add learning disorders. Early interventions may aid during elementary years, but long-term effects may be non-significant. Individuals with disabilities who receive early intervention treatments still experience significant problems in upper educational settings. According to Reeser, Previtt, Petcher, and Proctor, 2007, college students with learning disabilities and/or ADHD showed significantly more problems than the control students who had no diagnosed disability. These students reported more difficulty in ability to apply time management principles to academic situations, their ability to direct and maintain attention on academic tasks, skill at identifying important information for further study from among less important information, and their use of test preparation and test-taking strategies. Furthermore, college is a time for new stresses that early intervention cannot prepare for, requiring for more long-term preparatory intervention methods to be developed to aid individuals with disabilities to make a transition to the workforce or upper education. According to Nelson and Gregg, 2012, there has been a substantial amount of research done where individuals with a learning disability or ADHD will report having significantly higher levels of depression and anxiousness when compared to college students who do not have these disorders. College students who had higher functioning autism spectrum disorder were also significantly more likely to show symptoms of social anxiety, depression, and aggression, according to White, Allendek, and Bray, 2011. Early intervention strategies rely on reinforcement and recognition of setting cues. Early intervention can teach a young child coping strategies and help them, their teachers, and their parents have them engage and learn. However, once they are older, settings tend to change, and their ability for reinforcement to occur lessens when there's no guardian or teacher to reinforce. Settings such as work or college force students to manage their own behaviors. These tend to lead to problems in college where coursework is significantly greater, possible accommodations may be unknown, and professors' tendency to interact less directly with their students. To conclude, early intervention is effective in the short term of teaching young children how to cope with their disabilities during their early years. However, during time periods where these students will be introduced to higher stress situations, early intervention just won't be enough. This is why we of the negative push for more late-stage interventions to be implemented to prepare the student for the future as opposed to solely the present.
After listening to both the affirmative and negative speeches given, I can unbiasedly determine that the affirmative side had the most compelling argument, meaning that early intervention is the best solution for children. As Stacy stated in her initial argument, early intervention is important because it minimizes the need for special education as a child grows older, as well as increase the child's independence. In her argument, Stacy made impressive connections of early intervention to ADHD, autism spectrum disorder, reading disorders, and dyslexia. In Stacy's research, she found that these students made significant impacts on IQ, language, and adaptive functioning development, skills that are extremely important in a child's development. In Kristen's affirmative speech, she addressed the negative side's argument that the RTI model is not a beneficial approach by stating that IDEA directly establishes that the RTI model is a scientifically based product and therefore extremely accurate in determining a student's disability. Kristen's argument proved to be very strong mainly because it highlighted the fact that late intervention approaches wait for the child to fail in an educational setting, which can cause emotional damage as well as allow them to fall further and further behind in school. After listening to the negative responses to the assigned topic, I can fairly say that both presenters provided valid evidence to support their claims. Megan's negative argument attempted to dispute Stacy's affirmative claims by highlighting that research supports that late intervention using a free volunteer reading technique can work for struggling readers and that there is no critical period for learning to read. Megan also spoke about the benefits of homeschooling in which some students who may have disabilities benefit from. Although Megan offered interesting perspectives to viewing early intervention, Kristen's affirmative argument validly disputed the majority of her claims, and for that reason, Megan's argument was not as strong. In Tyler's negative argument, he addressed the effects of intervention practices during higher education within a child's life. Tyler highlighted the fact that many intervention techniques developed in early childhood are often harder to maintain as the child grows older. A college student's life is mainly unsupervised, and therefore students who suffer from disabilities, such as ADD, often struggle to maintain the intervention practices taught to them as a child because their parents are no longer there to supervise them. Although both negative presenters introduced varying perspectives to early intervention, in my opinion, their evidence was not as strong compared to the affirmative side. The research and studies produced within the special education field have, for the most part, always supported early intervention strategies, and the tests placed on children to validate this fact are much stronger than the latter.